It's so funny how we talk about HIV, we talk about hepatitis, we talk about gonorrhea, and we also talk about syphilis. But we also fail to talk about the most common type of sexually transmitted infection, which is very detrimental if not treated properly and on time. Good day, everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, I'm going to be sharing with you 11 surprising facts about chlamydia. 11 surprising facts about chlamydia. If you are a man, you are a boy, girl, woman, and you are sexually active, this particular video is for you. But before we go into details into this class, if you are new on our YouTube channel and these are contents you are interested in, your reproductive health, please click on that subscribe button, turn on that notification bell so you don't miss out. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Let's go there. All right, welcome back. Like I earlier said, today I'm going to be sharing with you 11 surprising facts about chlamydia. But first of all, I want to let you know that chlamydia is a sexually transmitted infection that is caused by a bacteria known as chlamydia trachomatis. Yes, it is sexually transmitted. Now, the 11 points, the 11 interesting facts. The first one I have to share with you is that chlamydia is a silent infection. We've heard about hypertension being a silent killer. So chlamydia itself is a silent infection. Why is it so? It is so because 70% of women and 50% of men who have chlamydia do not know that they have chlamydia. So a man, a woman might have chlamydia and they might not show the signs and symptoms attached to it. That is why if you are sexually active, it is very important you go for regular screening and get this sexually transmitted infection treated. Am I making sense? So then that takes me to the second surprising fact about chlamydia. The second point I have to share with you is that chlamydia is a leading sexually transmitted infection in the world. I'm not talking about a particular state. I'm not talking about a particular country. I'm talking about the world, the entire world. Chlamydia is the leading sexually transmitted infection. In the UK, chlamydia is the leading sexually transmitted infection. In the United States, chlamydia is the leading sexually transmitted infection. I was checking through the UK website and I saw that, I'm going to read, among the main infection contributing to the overall total of new STI, chlamydia diagnosis in all ages increased by 24.3%. From 160,279 diagnoses in 2021 to 199,233 diagnoses in 2022. You can see the incident rate increase, the occurrence increased by 24% within a year. So chlamydia is not just an infection, but rather it is a leading sexually transmitted infection in the world. Then that takes us to the third point, which I want to share with you. And that is chlamydia can lead to infertility in both the men and the women. Yes, I'm going to start with the women first. In terms of those women, when you have infection, these can go up into the fallopian tubes. It can go up into the other reproductive organs or the internal reproductive organs. And when that happens, and when there's a repeated chlamydia, things like that, it's going to cause scarring in the tube and in the other parts of the reproductive system. And when that happens, it might be difficult for sperm to get to where the egg is to get it fertilized. And when there is no fertilization, what do you expect? There is not going to be a baby. And sometimes the sperm might successfully get to where this egg is, fertilize this egg. When the embryo is formed, it might be difficult for that fertilized egg to travel down to the uterus, thereby causing what? Infertility. And this chlamydia can lead to pelvic inflammatory disease. In my videos, I've talked about several times about PID, where I talk about PID can be a cause of infertility. So you can see chlamydia can result in infertility. In men, it can lead to the inflammation of the epididymis and also the swelling and pain in the testicle. And we all know that these are part of the male reproductive system. You can see chlamydia can lead to what? Infertility. Then that takes me to the fourth fact I would like to share with you about chlamydia. The fourth surprising fact I have to share with you is that chlamydia can affect other parts of the body. And let me tell you the parts of the body that can be affected. It can affect the eyes. When these bacteria get to the eyes, it can result in conjunctivitis. So chlamydia can affect the eyes. It can affect the anus for those that get involved in anal sex. So don't think because you are involved in anal sex, you can't get chlamydia. It can affect the anus. Chlamydia can also affect the throat for those that are involved in oral sex. It can cause the sore throat, and you will not know. Chlamydia can also cause arthritis. That's the body's immune response to this chlamydia. So for those that don't know that chlamydia can affect other parts of the body, I think it's now you know, right? So then that takes me to the other point which I want to share with you. The fifth point is that chlamydia is more common in young people. Yes, it's more common in young people. It affects the old people, yes, but it is more common in young people. I was going through the UK website and I saw that the impact of STI remained greater in young people aged between 15 to 24 years. So if you are young, you are sexually active, it's advisable to go for screening. Then that takes me to the sixth point, which I want to share with you. And that sixth point is that chlamydia is preventable. Chlamydia can be prevented. It can be prevented with the use of condoms and dental dam. Yes, with condoms, it's easy for you to prevent chlamydia. Remember that you are not going to know if your partner have it because your partner might not be showing these signs and symptoms, especially partners that has not been thoroughly screened. They might not be showing these signs and symptoms. You have sex with this person and you get this chlamydia. All right, so it is preventable with the use of condom. If you are young and you are sexually active, it's advisable you use a condom. The seventh point I want to share with you is that regular testing is very important. Regular screening, especially if you are sexually active and you are not using protection. Yes, so when I advise you to speak with your doctor, no doctor is going to shame you for requesting to get a test done. If any doctor shame you, is either feel free to sue the doctor or you change the doctor. So when you get to your doctor, they are going to take a swab to do a swab test or some urine sample to do a urine test. But these days, there are some home kits that you can get and use to check at home. So no matter the way you are going to use it, visiting your doctor or doing it at home, it is important to get screened regularly. All right, then that takes us to the eighth point which I want to share with you. The eighth point I have to share with you is that it can be transferred from mother to child. From mother to child, chlamydia can be transmitted during childbirth. During childbirth, this infection can be transferred from a mother to child, and that can cause conjunctivitis in a child and even pneumonia in a child. So if you are pregnant, you are a pregnant mother, it's advisable to get screened for chlamydia too. Not just gonorrhea, not just HIV, but also chlamydia, to avoid the unborn baby when giving birth from getting blind, so the child doesn't get blind as a result of what? Conjunctivitis. Then the ninth point I want to share with you is that you can get reinfected. Yes, you've treated chlamydia doesn't mean that you are not going to get it again. You can get reinfected. And I noticed that why most people get reinfected is because they treat themselves and don't treat their spouse and don't treat the person they're having sexual encounter with. So you don't have to be shy. If you are diagnosed of chlamydia, let your spouse know. Both of you get screened and both of you get treated. Because if you alone get treated and you went back to that same partner to have sex, definitely you are going to get reinfected. And during the course of your treatment, it's advisable you don't have any sexual intercourse. So there are some treatment that you can take for just one course, and there are some treatment that you can take for 7 days. You can get reinfected. Stay aware. The 10th point I have to share with you is that treatment is easy. All you just need to do regularly is to get screened. You don't have to be shy. Treatment is easy. Yes, it can be treated with antibiotics. So your doctors are going to give you some antibiotics to help you treat. And like I earlier said, while treating yourself, don't have sexual intercourse during that period, and also get your partner treated. It is easy. It has a cure, unlike other STIs that don't have a cure. Not all STIs that don't have a cure. Then the 11th point I have to share with you is that if you have chlamydia, it puts you at risk of getting infected with HIV. If you have chlamydia, what did I say? The 11th point, it puts you at risk for getting infected with HIV. Let me tell you something. Your body recruits inflammatory cells when you have this chlamydia, which are the CD4 and CD8. And these are the cells that are actually needed for HIV to be easily activated. Let's put it that way. So if you have chlamydia, you can easily get infected with HIV. And the bonus point I want to share with you is that the pets, your dogs and cats, can also have chlamydia, but it cannot be transferred from the pet to humans, and humans cannot transfer it to the pets because there are different strains, different strings of chlamydia. So this is what I have to share with you about chlamydia. Remember, regular screening is very important because chlamydia is a silent infection. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy saying thank you. Bye, and see you in our next video.